Hi friends, so we are now discussing our congenital series in which there is problem by birth in musculoskeletal system, either the muscle, skeletal system or ligaments are deficient, disturbed. So abnormal, things will be looking like abnormal. Like in lower limbs, the toes look like very large in size, one toe or many toes. So that is known as macrodactyly, and this is quite commonly associated with various situations, like it can be because of neurofibromatosis, it can be because of the hemangiomatosis, the vascular situation. So when it requires surgery, one most common reason is cosmesis. The people feel it that it is looking like very bad, very abnormal, but that has to be consulted with the patient that whether we should go for surgery or the treatment part or not. Second part, the functional use is disturbed when the one toe is quite enlarged, quite big in size with respect to the other toes, and the maximum, most good reason is the pain and difficulty in wearing shoes. So this for this problem, the treatment is being given by our Indian doctor, Dr. Kotwal and Dr. Faruqi. They advised this surgery in 2 stages. Suppose the deformity is a convex deformity and one side is convex and one side is concave. So in stage 1 surgery, defatting is done in the convex side of the deformity. After some time, when the deformity is again seems to be enlarged, then the concave side defatting is done. Along with it, the bone shortening is done. So in these 2 stages we do this surgery part. Second thing, second possibility, you see when the toe size is increased up to the adult level and it is now quite big enough, then you do the epiphysiodesis. Now that size will not increase, and you have to do the defatting part after this thing the sizes increases. So epiphysiodesis, once you achieve the adult size of the toe, then epiphysiodesis is done. So this is how you treat the macrodactyly. Please like and subscribe. Life care.